Hi everyone, welcome back. It's Michelle Hall. So this is the YouTube channel to help dental nurses. So welcome if this is your first time, or if you've been on my channel before, welcome back. I'm going to go through today manual charting. So Palmer's notation, which is used in England. These are the old-fashioned cards, and this is how we used to chart. So I am going to explain, I'm going to do some demonstrations of different charting as well, and how I would write the patient notes. Most nurses now do everything on the computer, so there's no need for these old-fashioned paper cards anymore. We do need to keep these though for 10 years, and they're normally stored, if you used to do paper notes, they will be stored in an attic or a cellar somewhere, just in case, for an audit purpose, or again, deceased, if somebody needs dental charts for a deceased patient. It could be that they need it for forensic analysis. So it's always good, and it is data protection to keep these charts. Right, so the first thing is, if we had a paper chart, you can see the patient's name, the date of birth, as much detail needs adding as possible, postcode, address, and phone numbers on what dentist they work with. What we would do, if this was a patient today, so let's see, it's the 28th today of the 1st, 2021. So the treatment, I would write examination, or 6/12. Has anyone seen that before? 6/12, 6-month appointment out of 12. It could be a 3/12. A 3/12 would be wrote like that. 3/12, every 3 months, might be seen for scaling, or to keep an eye on certain teeth, what might be decaying. So with your examination, you do an extraoral exam. You do an intraoral exam. So you'd write this on the patient's notes. Examination, EO means extraoral, IO means intraoral. So with regards to extraoral, the dentist will be checking underneath the floor of the mouth, checking the jaw, TMJ, open, shut, TMJ, fine. A nurse would have to write TMJ, NAD, which means nothing abnormal detected. So this is the nurse's responsibility to write all this down. They'll be checking, like I say, the extraoral to see if there's any lumps, bumps, checking out for cancer, any lumps, any swellings, any lymph nodes, what might be swollen. If they're all okay, the nurse has to put NAD, nothing abnormal detected. Then the dentist goes into oral, obviously wearing gloves, PPE. He would open the mouth, he checks the cheeks, patients open their mouth, lift their tongue up, and he's checking the floor of the mouth. Again, he's looking, you've got 2 salivary glands there, he's looking if they're inflamed, they could be infected, they could be any lumps at the floor of the mouth, any cancerous lesions. We need to be checking for everything. He'll pull the cheek out, have a look, see if there's any white patches on the cheek. Again, he's looking for cancers. There is something called lichen planus, which is white on the cheeks, nothing to worry about, but again, he's looking out for any kind of oral disease, anything what could cause harm to the patient, or potential malignant cancers. He's also looking for any ulcers, so he might pull the lip down and look around the lip area. Again, he's looking for any ulcers. If they're there for 2 weeks or more, they need an instant referral just to check they're not cancerous. So that's the whole process of intraoral, extraoral, and TMJ, the jaw. Then he'll do soft tissue exam, so STE. Again, he's checking all the soft tissues, and then you would write NED. So that's the basics on there. That's your examination. Then he would do a BPE. Again, I'm going to go through in another video the setup for a dental examination, but for a nurse, you'd set up a mirror, a probe, a BPE probe, and you'd also set up a 3-in-1. So you might have seen yourself when you go into the dental practice, he's blowing the tooth. He's just blowing to get the saliva out of the way so he can then check with the mirror and probe. And he puts the probe in the tooth just to see if there is any soft decay, if there's any breaks in the enamel. That's all he's doing. So the BPE probe, that's the one with the black and white stripes on it. It's got a ball end, and the dentist will prod around the gums to see if there is a BPE problem. So BPE stands for Basic Periodontal Examination. So I would write BPE on my paper notes. Your head is chopped into sextants, so across and down. So 1, 2, 3, 4. Okay, and then it's cut again. So then you've got 6 sextants. So all he's doing is checking the back upper molars. So it might be there a 0 when he calls out, means absolutely fine. It might be he starts prodding around the front of the teeth. All this area could be a 1, which is again fine. You might go around this back part. You might say that's a 2. If it's a 2, it might mean there's a bit of plaque there. His probe is going a little bit under the gum, so the gums come away from the teeth. And again, at the bottom, it could be this quadrant, let's say 1 for example. Now, the lower sometimes and mainly is a 2 because you've got them 2 salivary glands there. A lot of people get tartar, which is hardened plaque, which builds up. So they might need a scale and polish. So 9 times out of 10, patients do normally score a 2 down there. And again, you check this sextant. Again, let's just go for a 1. So with these scores, what he's done on his basic periodontal examination, if it's a 0, absolutely fine. 1, absolutely fine. Number 2, there might just be a little bit of plaque there which needs removing, which is hardened up and gone into tartar. So I would recommend a scale and polish for this patient. So as a nurse, if you're charting, if these was all 0s, I wouldn't normally, unless the dentist requests it, get a scaly tip out. They don't normally need one. If they've got 1s and 2s, definitely start thinking about setting up your scaler unit and the Profi cup, the Profi paste as well. That's the basic notes. The other notes, what we have to write down as well, we need to check the OHI, so the oral hygiene. And we need to give informative information as well. We might put smoking down on here because we need to be checking smoking. If the patient smokes, if how many, do they want to give up? Is there some advice that that patient needs? Alcohol. Okay, so again, we would write these down. It might be a child who's 8 or above. We might need to check the ortho. See how the teeth bite together, whether they're class 1, class 2, and then we write that down. We need to check the patient's medical history. So we'd put MH. That's my initials, by the way, Michelle Hall. So MH. So if the medical history is absolutely fine, you could put fine, or you could put, again, NED, nothing abnormal detected. If there was something, it could be everything's completely fine. I don't know, they might be diabetic. So you write that down. Alcohol, NED, or you might just put 1 unit a week. It's always good to ask the patients all of this information. How much alcohol do you drink? How many cigarettes do you smoke a day? So if they do smoke, it could be they smoke 1 a day. Always gain consent. Ask your patient, would you like to think about giving up smoking? Don't assume they want to. They might enjoy smoking. It might be a social thing. It might be to relieve stress, or there might be loads of different reasons. So always ask them, would you like to give up smoking? If they do, then you could just say it's bad for your health, it's bad for your oral tissues. You could go ahead then and give some more further advice and give a leaflet how to stop smoking. So then with the oral health information, you could just write down the OH advice given. Again, that is mainly your notes. Some dentists like further notes on there, areas of discussion. It might be that you've then decided to do a scale and polish on the patient, which you'd then obviously wear your PPE, you'd assist. Afterwards, the dentist will then write his notes. So he might put scale and polish carried out today, which we know is a S&P. Carried out. Then you could put advice given for smoking, discussed alcohol content, we gave oral health advice, and I have talked about flossing today. And it might be that you've advised the patient to get some floss. Everything which is discussed needs writing down, or you obviously put on your clinical notes, okay? Anything urgent would go at the top. And again, anything urgent here, it might be that the patient's pregnant, or they might be on medication or have heart problems. Anything what's going to contraindicate your dental treatment needs to be on here. You could highlight it, you could flag it up red, anything on there. But again, if you are on a computer, it'd automatically come up in a box anyway. Not many practices use these anymore, but you still need to know about them for your qualification. Right, so let's talk about the back. Palmer's notation then. So what is Palmer's notation? This is it. There's something called FDI notation. It's an American version of charting, and I will go through that in another video. But what we use in the UK, some European countries use that as well, is the Palmer's notation. So you can see the boxes here, box 1, box 1. These boxes are existing. So let's pretend this is a brand new patient. You don't have to put the full date, you could put the month. So we'd put 0121 near number 1 box, 0121. So the little box, so then the next 612 appointment, 6 months, would go in this box. So you put the date there until all the cards filled out. It might be that the card is filled out on the front. You would then get a new card and start charting on the new card with the new date, so it matches that dental exam. So what I'm going to do now is put a date down here as well, because it's a new patient. We're going to put existing fill-ins, what are there. So I normally put the full date there. So it's the 28th, 0121. So this is confusing. This is my right hand, this is my left hand. When you're charting, it's completely different. My left is my right, and my right is my left. You've got to think of these as your teeth. So you've got 32 teeth in total. What I tell trainees to do is draw a midline. So your 2 front teeth are your ones. So draw a midline through your ones, and you can draw a midline here so you know. So that's half of your head. 8 teeth there, 8 teeth there, 8 teeth there, 8 teeth there. Altogether 32 teeth, okay? So when the dentist is behind the patient and is pulling the cheeks and is charting and is calling all these weird numbers out to the dental nurse, when he's saying upper right, that is your left. If you imagine he's sat with a patient here, and that is his right, but you've got this chart, you can't bend that round your face, can you, chart? So you have to chart like this. So when he says upper right, that's your left. So what you could do, I normally get the trainees to write on here the upper right, the upper left, which is opposite. So we know my left is their right. Then you might say upper right. So you start on your left box. Number 8, missing. If a tooth is missing, you put a line through it. Number 7, has an MO filling. So, tooth missing, MO filling. Again, going back to this midline, anything near to that midline is what's called a mesial. So I'm going to demonstrate a mesial cavity now on number 6. You just do a little round dot, it's a mesial cavity. So if it's an MO, it goes onto that occlusal surface. So let me demonstrate what an occlusal looks like. It's the middle part of the tooth, it's a circle. Anything away from that midline is called a distal. So you draw on the distal box. I will do another video as well of me charting this, it's a lot to take in. So everything what's near to that midline is called a mesial. If you went on this side, the mesial would be on this side of the box, because it's near that midline. And that's how you would draw a mesial. The distal on the upper right would be like this, distal. Okay. If a tooth is okay, you might say upper left, 3, 2, 1. You just put a dot on them boxes. He knows the tooth's alright. Then you'd go to the upper right side, which is your left. 1, 2, 3. Okay, so you'd put the dots. 4 has a DO cavity, so it's coming away from that distal So it's not near the midline and it goes into the occlusal. So a DO on this side would look like this. And it's existing filling. So we're filling out this existing box because we want to know what the patient's mouth looks like. If the dentist says upper right 5 has a crown, you write CR on the existing box. If it needs replacing, you might say crown needs replacing. On the box above, which is to do, you would put a circle around it. And we're replacing a crown. So I'll put CR with a circle around it. Number 6 has a buccal filling. So buccal is always near your gums. So this part, the top of your tooth, is called the buccal. When you get to the lower, the buccal's on the lower. So when you're charting the tooth box, the buccal would be at the top, wouldn't it? So I'll just demonstrate that. If it needed replacing, so it might be 6, the buccal needed replacing. Buccal needs replacing. We can see it's existing here, but we're going to replace it. It's not a new cavity because the new cavities are hollow. If a tooth needs extracting, so let's say upper right 7 extracting, you put a cross on a slant. That's a tooth needs extracting. A tooth what's just been extracted has a X through the box because it's still healing. Okay. Again, we spoke about tooth missing, a line that way. Underneath, let's go down now to the lower left. So let's say lower left 8 is missing, 7 is okay, so we do a dot. 6 has a buccal filling, so we need to put in the existing box. Buccal filling. And then we're going to go with the lower right 5. We could put needs an occlusal cavity, so there's nothing existing, it's a cavity, so we do a circle in the box. 4, we could put that tooth's missing, gap closed. So all you do for that is do 2 arrows facing each other, so it looks like a line with a cross through it. So that means the tooth is missing, but the gap is closed. So the 6, what tooth did I say? The 4th, okay. So the tooth behind that has moved forward and it's closed that gap, okay? And then 3 might be alright, 2 might be alright. Now, number 1, when you get to the front incisors, they're not called occlusals. It's an incisal cavity, and it's a bit more flatter, so you can't fit an occlusal on that biting surface. So these boxes at the back of the back teeth represent each surface of your teeth. If there's a bridge, some dentists just like you to write bridge. Or there's something what's called bridge abutment and bridge pontics, and then the dentist will tell you which tooth is which, and you just write BA or BP in each box. So it might be number 4 needs a crown, so you do a circle around the box. So when the dentist is finished this chart, he will look at what's already existing in that patient's mouth and what needs doing. PE, let's go to the 8. PE means partially erupted, so your wisdom teeth, they're your number 8, so they might be partially erupted, so you just write PE in that box. So that's the basics then of the chart. It's a lot to take in. As a trainee nurse, I would recommend you have a go at this, put all the terminologies down and then write on here. So you would put, so the one with the cross is extracted, the one with the line going through it needs extraction, which we call XLA. And then I would write on here buccal. Distal, mesial, let's get occlusal, let's say MO, which is a mesial occlusal, do you remember? Okay, so I've just wrote everything on there, all the terminologies. Well, it's not them all, to be honest, they're the basics. There is some other ones, but that's the basics, what you need to know for now anyway. Again, I am going to go through this again, probably filming it this way and go through it in a bit more detail and put some arrows on the video so you can understand it a bit better. But yeah, that is basically what Palmer's notation is. Dental charts, old paper notes. This is called an insert. The inserts then are kept in an outsert. It's just one of these, but in envelope form. And all you do is push this in. They end up being about this bulky. Sometimes you have to sellotape 2 of these together. But again, that keeps all the patient notes. They should be kept in a lock cabinet as well. So that's Palmer's notation, everything explained there. Again, I'll post this one and I'll put another video. If there's anything more you want to know, please put a comment so I can understand if you've learned anything new from that or if you wish to know anything further. So yeah, just please let me know in the comment box below and I'll see you next time. Thank you.